Hi, and welcome back to the Dr. Ramsey Show. It's interesting, if you remember, 2 times ago in the Dr. Ramsey Show, not too long ago, I was reading different articles that were coming out in different ways saying hormones are good for women. And this is the first time in many, many years. I've been in practice for 26 years, and this is what I've been doing for 26 years. And all of a sudden this year, we're seeing more companies talking about menopause for women, treating menopause for women. And it's so exciting to me because I wasn't sure I would see this in my lifetime. But it seems like the underserved women are now being served in the second half of their life, and I can't tell you how excited I am. So I'm going to read this. This is from the New York Times on February 1st of this year. It says 5 things to know about menopause and hormone therapy. So there has long been an effective FDA-approved treatment for some menopausal symptoms, but too few women have a clear picture of its risks and benefits. What's interesting about this is hormones are only approved for women for symptoms. They're not approved to reverse osteoporosis, which is a crime. They're approved for hot flashes. What's worse, hot flashes or osteoporosis and breaking a bone. So this is how weak medicine has been for women in the aging process. Menopause has the worst PR campaign in the history of the universe because it's not just hot flashes and night sweats. A sexual health expert and assistant clinical professor says menopausal symptoms are more varied and can be more debilitating than many people know. During the transition to menopause, women may also experience sleeplessness, mood changes, depression, weight gain, joint pain, vaginal dryness, painful sex, among others. Bone loss accelerates. In women who have a genetic risk for Alzheimer's disease, the first plaque are thought to form in the brain around this time. There are long been effective FDA-approved treatments for several of these symptoms known as menopausal hormone therapy. But because of fear and misinformation, too many women have a clear picture on its risks and benefits. FDA-approved, I don't understand that. The New York Times Magazine covered story this week says examines hormone therapy and menopause, unpacking what the research really tells us. Hormone therapy eases several menopausal symptoms and has some additional health benefits, a lot of health benefits. Hormone therapy has been shown to ease hot flashes and sleep disruption, and there is some evidence that it helps with depression and achy joints, lots. Now, they're talking about female, they're talking about estrogen and progesterone. Thyroid is what treats pain in people, so NAMS, you'll hear about them later, doesn't talk about thyroid and or testosterone because it's not FDA approved for women. It also helps prevent and treat menopause, genitourinary symptoms, a collection of symptoms including urinary tract infections, pain during sex that affect half of the postmenopausal women. Guess what? It affects all women who don't take hormones, not just half. It decreases the risk of diabetes, protects against osteoporosis. The cause of osteoporosis is lack of estrogen. Because of the health risks associated with hormone therapy, it is recommended for women who have bothersome hot flashes and certain other menopausal symptoms, not for preventive care. Untrue. My women come in 20 years old, 30 years old. We start treating them for menopause. So when they get to menopause, they don't even know they're there until we do their annual labs. So it's not true that it's not for preventive care. It's 100% for preventive care. In addition, it prevents Alzheimer's, heart disease, cancer, and osteoporosis. So I'm not sure why they say that. Hormone therapy carries health risks that vary by age. Untrue. No risks in giving hormone replacement therapy unless it's synthetic, and NAM still talks about Premarin. The age at which women begins hormone therapy is important for assessing her risk, increased risk of heart disease, stroke, and dementia. True. Okay. Here's a question they ask. How can I find some relief from these symptoms? A low-dose birth control pill can control bleeding issues and ease night sweats during perimenopause. Yes, they can, but why would you want to be on a birth control if you're perimenopausal? You want to be on bioidentical hormones. Not estrogen yet, but bioidentical hormones. Avoiding alcohol and caffeine can reduce hot flashes, yes. While cognitive behavioral therapy and meditation can make them more tolerable, yes. But guess what? You don't have to work that hard. Menopausal hormone therapy and the selective serotonin reuptake inhibitors, which is antidepressants, can also ease some symptoms. We don't want to ease symptoms. We don't want to treat symptoms with a drug. We want to treat what's wrong. We want to treat the cause. The cause of all these symptoms is lack of hormones. So I don't know why this article is talking about all these other things. It drives me a little nuts. How long does perimenopausal last? We don't need to ask that. What can I do about vaginal dryness? There's several things you can do, like lubricants. Guess what? You don't need lubricants if you have estrogen. You only need lubricants if you're making love a lot. But if you're making love like 3 times a week, you don't need lubricants if you're on estrogen, but it's nice to use lubricants anyway. Unfortunately, most women will not get 100% relief from lubricants. Estrogen, or actually they're saying from estrogen, and that's not true. Women get relief from estrogen vaginally, your bladder, brain, skin, hair. It gets everywhere. It doesn't skip the vagina. Last thing, for women who go through early menopause before 45, hormone therapy is recommended because they're at greater risk for osteoporosis, correct? If they don't receive hormones up to the typical age of menopause. For healthy women in their 50s, the increased risks for hormone therapy are considered low. Zero, not low, zero. Where was I? There are greater risks for women who start hormone therapy after age 60, not bioidentical, yes, for synthetic. No definitive research has yet followed women who start in their 50s. That's untrue. There are thousands and thousands of articles. They're just not read. To stay on them continuously into their 60s, guess what? We're staying on them the rest of our life. This is NAMS, and we've talked about NAMS, North American Menopause Society, who creates all the guidelines. They're always talking about synthetic hormones. Yes, bioidentical made the market in 2012 to their plan, but at a very low dose. My practice is the research. My practice mirrors the thousands and thousands of articles that's and some are lacking as they're synthetic. Some don't say what they're using in the articles, but the bioidentical ones are very crystal clear. There's hundreds of them, turning into thousands because they're being done more and more since they have such good outcomes. Wanted to say one other thing here. Oh, so most of this is from the WHI, which we've covered many times together, that article that came out in 2002. At the highest risk for hormone use are women who have had a heart attack, breast cancer, stroke, or clot, or women with a cluster of significant health problems. These women need it more than most, and they're saying not to, but these are the women who need hormones to prevent a secondary outcome. For everyone else, the director of Center of Women's Health at Mayo says the decision has to do with the severity of symptoms as well as personal preferences and the level of risk tolerance. Rather, it has to do with how do we feel, how do we want to feel, how do we want to age. It's not about how severe we are. Start hormones before you get severe, and you'll feel the best the rest of your life. So it's good that it's hitting the media. It's great. Women are going to get something. And it's being publicized, so that's wonderful. Just know that whatever you're reading, they might be talking about synthetic, they might be talking about bioidentical. You only want bioidentical if you want your best health outcomes. Thank you for listening. I know that was long. I apologize, but I just think it's interesting and poignant, and I hope you have a great day, and we'll be back next week. Bye-bye.